Hello, my name is Gwendolyn Singleton. I'm a student of Purdue University Global Family Nurse Practitioner Program. My patient presentation today is on Mr. Thomas Dawson. He's a 33-year-old patient who presents with shortness of breath, fatigue, and cough. He also complained of fever, and these symptoms have been occurring for the past 4 days. He initially had a complaint of a non-productive cough and some mild shortness of breath. He now states that the symptoms have become worse. He also complains of pleuritic chest discomfort. He was offered but declined the influenza A vaccination. He states that he is really concerned and feels really bad because he has never felt this way before. He's been out of work for the past 2 days, and his girlfriend insisted that he goes to the clinic for an evaluation. He is usually healthy and usually only comes to the clinic once a year for his annual checkup. He does receive a routine DOT examination with his job every 2 years, and his immunizations are up to date. He takes ibuprofen 400 milligrams every 6 to 8 hours as needed for pain and fever, or he alternate with acetaminophen 650 milligrams every 4 to 6 hours as needed for pain and fever. He does not have any known drug allergies or any medication intolerances. His past medical history, he does not have any active problems, no chronic illnesses, major traumas, hospitalizations, or surgeries. His father is 57 years old and has hypertension. His mother is healthy, and he does not have any siblings. He lives with his girlfriend, and he is in a relationship. He does not have any children. He graduated from high school. He denies tobacco use and drinks 2 to 3 beers a week. Review of systems. He denies weight changes, chills, and night sweats. He does complain of fatigue and fever. He denies syncope, dizziness, chest pain, or palpitation. He denies a history of pneumonia or tuberculosis. He has a productive cough with yellow or green sputum. He also has some shortness of breath and pleuritic chest pain. His skin is dry and intact. He denies any skin problems. His eyes and ears are fine. He denies any problems with those. He has mild sore throat, but he denies any dysphagia. He denies any abdominal pain, nausea, vomiting, or constipation. He denies any urinary problems. He does complain of chest wall pain with coughing. He does have diffuse myalgia. He is oriented ×3 and has a slight headache. He denies any depression, but does report anxiety and trouble sleeping for the past 3 days due to coughing. His anxiety is due to shortness of breath. He does have some swollen lymph nodes, and he does report fatigue. His vitals are 120/80 in the left arm and 120/80 in the right arm. Respiratory rate is 24. Heart rate is 120. 91% is his SATs. 103.2 is his temperature. His BMI is 24.4. He is 6 feet 1 inches tall, and he is 185 pounds. Objectively, he appears older than his stated age of 33. He is alert and oriented ×4. He appears ill and distressed. He answers questions appropriately, and he is clean and well groomed. His skin is warm, dry, and intact. His pupils are equal and reactive to light and accommodation. His neck is supple. He does have some cervical lymph node tenderness bilaterally. His tonsils are slightly enlarged and have mild redness. His external chest wall is normal in appearance. His heart rate and rhythm are normal. Pedal pulses 3+ are 3+ bilaterally. He has symmetrical chest wall. He does have some chest pain when coughing. His respiratory rate is regular and normal. He does have lung crackles with productive cough. He has some mild tachypnea. His right upper and middle lobes have crackles anteriorly and posteriorly. He has positive for echophony and bronchophony. His whisper pectoral, he does have a positive whisper and pectoral test. He has increased loudness of the whisper on auscultation. His voice sounds louder over the areas of consolidation. His abdomen is soft and non-tender. Bowel sounds are active in 4+ quads. His ambulatory does have some chest wall pain with coughing. He has diffuse myalgia, and he moves all extremities. C1, 2 through 10 are grossly intact. He denies depression, and he does have some anxiety due to coughing. Primary diagnosis is pneumonia, community acquired. This is an acute inflammation of the lung parenchyma, usually infectious in origin. 3 differential diagnosis is COVID. He has symptoms of fever, headache, shortness of breath, sore throat, and fatigue. Asthma is a chronic inflammatory obstructive disease of the airways that may have some symptoms of shortness of breath, coughing, and some chest tightness. And next is influenza, which includes symptoms of fever, chills, myalgia, and malaise. The plan for this patient is to continue the ibuprofen 400 milligrams every 8 hours as needed for fever and pain. Also, acetaminophen 650 milligrams every 4 to 6 hours as needed for fever and pain. And amoxicillin 1 gram 3 times a day for 5 days. He is to rest and also increase his fluids. Diagnostic tests are an x-ray is to be done, and that is to determine whether or not there are any infiltrates, an ABG, CBC, influenza, sputum culture, and sensitivity, and gram stain. The patient is to take the influenza vaccination annually. There are no referrals at this time, and he is to follow up in 1 week.